Are you a chiropractor, physiotherapist, or osteopath and want to learn an evidence-based approach to managing the tough neuromusculoskeletal cases, including stubborn headaches, persistent dizziness, poorly managed chronic back pain, poor balance and falls risk? Hi, my name is Dr. Carlo Renato, practicing chiropractor from Australia and PhD candidate in neuroscience. It's with great pleasure that I announce a 4-part series, NeuroConnect, starting in Hong Kong, March 16 and 17. At the end of these 4 modules, you'll be the go-to practitioner amongst your colleagues for treating the conditions that no one else can help. In each 15-hour module, I've condensed 20 years of practice, thousands of hours of courses, and research for my PhD, and translated it into a course perfectly matched to today's chiropractor and physiotherapist. If you're looking at achieving better results with your current patients, or sharpening your clinical competency to stay ahead of the curve, or develop a leading brain-based rehabilitation clinic that sees all the challenging cases that no one else can manage, and have a long wait list, and have people travel from all parts of Asia to see you, then NeuroConnect is for you. Whilst each module can be taken individually, they've been designed to be taken as a series. Each module builds on the next. Module 1 provides a foundational understanding of the neuroanatomy and neurophysiology between the musculoskeletal system and the brain. Here we'll learn the effects of spinal dysfunction as well as therapies to the spine with respect to the brain. If you've been in practice for any length of time, every day you see patients with back or spinal problems that complain of poor memory, attention, poor body awareness, imbalances, dizziness, difficulty sleeping, poor reading, and altered moods. Do you know why? Can you explain it with contemporary neuroscience? After Module 1, not only will you understand it, but you'll be able to explain it to your patients so they can connect why they're seeing you with various back issues and how you're helping them with their life and health in general. You'll see what happens with neurological fatigue and metabolic tolerances, and not knowing this as a clinician could inadvertently make a patient feel worse. So understanding this is really important. Module 2, we develop the clinical skills with the history and examination. It's a hands-on module showing you how to effectively and efficiently perform the initial assessment. Here we'll take you step by step with forms, questionnaires, procedures, as well as the how to perform a complete neurological exam, as well as a 5-minute screen. This will equip you with all the tools you will need to see more patients, differentially diagnose the problem, communicate it effectively, and stand out from the crowd. Don't misdiagnose a back problem as a simple muscle or joint issue when in fact it could be a brain-based dysfunction, like a vestibular dysfunction contributing to lower back problems. Module 3 is focused on the spinal control, balance, and posture. We'll cover the common conditions to present to your office like dizziness, whiplash, scoliosis, and sporting injuries. In fact, mastering these conditions, you'll likely be able to help about 95% of your patient base right here. Learn how spinal control conditions like scoliosis, whiplash involve the sensory motor integration systems like the cerebellum and the vestibular system. And by doing therapies that involve eye movements, head position, proprioceptive retraining, can bring remarkable results to these cohort of patients that most traditional care sometimes doesn't help with. Module 4 brings us up to speed with the latest research and brain-based applications to effectively manage chronic pain, including headaches and migraines. Don't be like other chiros and physios and get caught up in treating chronic pain with local therapy to the pain side only. We all know that pain is a brain-based perception and not merely a dysfunction of muscles or joints. In many chronic cases, unless you address the biopsychosocial and cortical reorganization, the patient is unlikely to get better. The complete course has been accredited 60 hours with the Hong Kong Physio and Chiro Association. So join me in Hong Kong starting March 2019 for what promises to be a great clinical neuroscience series. Visit www.BrainHub Academia for further information, but please be aware there are only 20 spots available for the whole series due to the high level of hands-on practicals that the course requires. So if you're interested, register now, because if you do so, not only will you save 20% if you register for all 4 modules, but if you do so before December 31, you'll save an additional 10%. I look forward to seeing you in Hong Kong next year. Bye for now.